Okay, so ectopic pregnancy is a condition in which pregnancy implantation occurs other than uterus. That condition is known as ectopic pregnancy. It is defined as implantation of conceptus outside of the uterine cavity. That is known as ectopic pregnancy. It affects 80% of the pregnancy. Heterotopic ectopic pregnancy is defined as the combined tubal and uterine pregnancy. That is known as heterotopic pregnancy. It is believed that the main cause of tubal implant of gestation sac is low-grade infection, and it also shows areas still a reaction in which ectopic pregnancy, the uterine endometrium respond to the hormonal changes of the pregnancy and undergoes focal decidual changes. That is known as ectopic pregnancy. Now, the most common sites of ectopic pregnancy are ampullary site or fallopian tubes are the most common site where ectopic pregnancy occurs. Now look at the normal anatomy of uterus. So now this is the fallopian tube, and here most commonly ectopic pregnancy occurs, and this is the most common site of ectopic pregnancy. And the another position is ovary. In ovaries, implantation can happen in ectopic pregnancy can occur in cervix. It can happen in abdominal cavity or in C-section scar implantation of the conceptus occurs, and that position may be adopted by the conceptus. So that presents with the ectopic pregnancy. Now the fate of tubal pregnancy is spontaneous regression can be there, is tubal abortion will be there, tubal rupture will be there, and secondary abdominal pregnancy can be there, and tubal mole can be developed. Now as you can see here in this picture, it is shown that the pregnancy conceptus is implanted here. So tubal implantation is most common, and it may be there in the here in this position, or it may be implanted here in the cervix or in the abdominal cavity. So in this way, ectopic pregnancy can happen at uh, uh, any site of the lower abdomen, and other than the uterus. Position of the embryo in uterus in normal pregnancy. Now here most commonly normally embryo is implanted in common pregnancies, but in ectopic pregnancy conceptus is implanted here. It may implant in ovary, in uh, fallopian tube, in lower part of the stomach, and in cervix, in the abdomen. So in this way ectopic pregnancy can occur. Now risk factor for the ectopic pregnancy will be previous pelvic inflammatory diseases is most common, or previous ectopic pregnancy, or previous tubal surgery, intrauterine device placement can develop ectopic pregnancy, and prolonged infertility can cause ectopic pregnancy. The differential diagnosis will be acute appendicitis, diverticulitis, threatened abortion, molar pregnancy, and ruptured corpus luteum can uh, uh, can be suspected as differential diagnosis for the ectopic pregnancy. Now, the signs and symptoms for ectopic pregnancy are unruptured ectopic pregnancy will present with the triad of amenorrhea, vaginal bleeding, and abdominal pain. And the classical signs are adnexal or cervical motion tenderness. Uterus shows normal size, and fever is rare in the ectopic pregnancy. In ruptured ectopic pregnancy, what will be the presentation? Severe lower abdominal pain, internal bleeding, hypovolemia, guarding, rigidity, shoulder tip pain, and collapse will be there in ruptured ectopic pregnancy. Now, diagnosis will be based. Initial test is urine beta HCG test for confirmation, serum beta HCG test, double time. Now, the serum HCG will be 48 hours in normal pregnancy, while doubling time for beta serum HCG in ectopic pregnancy is suboptimal. Based initial imaging will be transvaginal ultrasound, intrauterine gestational sac, yolk sac, and fetal pole. In ectopic pregnancy, no intrauterine gestational sac will be there. Empty uterus will be there in the ultrasound, and that will be the suspicion point for the ectopic pregnancy. Adnexal mass will be there. Free fluid suggests ectopic pregnancy. Now here you can see that uterus is empty, while implant is other than the site of the uterus. It is in the fallopian tube. That can be the suspicion for ectopic pregnancy. Ultrasound image shows the echogenic ring-like mass shown in the that is separate from the ovary, and the curved arrow shows the small amount of the free fluid. That is the confirmation for the ectopic pregnancy. Beta HCG discriminatory zone will be there, and laparoscopy is also gold standard investigation for the diagnosis of the ectopic pregnancy. So laparoscopy is performed. Now medical management will be considered when the following criteria are there. Clinical stable patient will be, and there is beta ICG less than 3000, ectopic pregnancy less than 4 centimeter, no cardiac activity, and no hemoperitoneum is there. But methotrexate medicine is the agent of the choice for the ectopic pregnancy. When beta ACG is elevated for 4, 7, 11 days, then methotrexate should be started, and beta ACG should drop by 15% by the day of 4 to 7. Contraindication of the use of methotrexate will be chronic liver disease, chronic kidney disease, active infection, immune deficient patient, hematological disorders, or patient having bleeding disorders, and breastfeeding mothers should not be given methotrexate. And follow-up should be there for the ectopic pregnancy, and surgical management will be laparoscopy and salpingectomy is the treatment of the choice, and laparotomy with salpingectomy, removal of the tube where ectopic pregnancy has happened. Salpingectomy is the opening of the tube, excision of the ectopic pregnancy of the patient uh, uh, is the option if the patient has only one fallopian tube. So that is the salpingectomy can be there in order to treat the ectopic pregnancy. So what treatment options we discussed? We looked at methotrexate, and laparotomy with salpingectomy. Now, these are three options for treatment of ectopic pregnancy. With these three options, we can treat the condition of the ectopic pregnancy. So, this was ectopic pregnancy where concept is implanted other than the site of the uterus, most common in the fallopian tube. Patient presented with the amenorrhea and pain and no bleeding with the unruptured and ruptured, presented with the hypovolemia. So in this way, ectopic pregnancy presents, and we treated the patient with methotrexate, laparotomy, and salpingectomy. So this was ectopic pregnancy.